Good afternoon. My name is Amanda Burton, and the purpose of this presentation is for Class N517, Module 7, Nurse and Health Advocacy. The issue that I will be discussing is Substance Use Disorder Initiative that's being looked at by our state and federal government at this moment. I'm very passionate about this initiative. My mother, who is and was a drug addict my whole life, watching her self-harm every day was harmful for me. And then when I got pregnant at the age of 14, my then husband and now husband was a drug addict. And it took many years and many trials and tribulations for him to stop using drugs. This is a subject that's very close to home for many Arkansans, and we deal with it daily. So what is substance use disorder? According to the American Addiction Center website, it is a medical condition that is defined by the inability to control the use of particular substances despite harmful consequences. In other words, SUDs occurs when an individual compulsively misuses drugs or alcohol and continues using the substance despite knowing the negative impact that it will have on their family. Through my research, persons ages 12 or older over the past year that have been diagnosed with SUDs within the United States is over 4 million people. And out of 50 states, there are only 8 that have facilities that specialize in addiction treatment. That number is very staggering. I have the pleasure of working for a long-term care facility, and we get to be the pioneers in the force behind advocating for our elderly population and making sure that these substances that are being given to them that are knowingly decreasing their lifespan are safely decreased. We've been able to educate patients and families at the importance of finding different alternatives to antipsychotics or hypnotics in the elderly. When we work our way inside the circle of the why, the when, and the how. Why are we attempting to get them off of these medications? It shortens their lifespan literally by years. It doesn't help the so-called behaviors. It just masks them under the medication. It takes a functioning adult who needs patient-centered care, such as maybe they like to read Western novels, or they enjoy folding laundry. Maybe they like to garden, or they just want to go for a walk outside in nature. Maybe they thoroughly enjoy bingo, but somebody else may not really like bingo. So you have to get to know these patients. And we do that with a resident iPage. It's to get to know the patients and their little quirks that they have. And you use those little quirks to take care of them every day in patient-centered care. And that's going to help with controlling the behaviors instead of masking it and having them be confined to a bed or a chair and telling them to sit. You're figuring out things that help them, and you're not having to give those antipsychotics. When we evaluate all of their medications on admission, we look for that certain diagnosis. If they don't have a certain diagnosis, then we start decreasing those medications safely with the help of a pharmacist. Once we safely remove the medication from the patient, we see a huge turnaround. Some residents and family members are hesitant on removing the medications because they've used them for years, or they remember the past trauma from their childhood. If the patient has the right diagnosis for this med and it is justifiable, we do not touch that medication. We allow them to keep that med. So what we try to do is for nurses to be pioneers and to impact this, we have to educate. We have to educate our families. We have to educate the patients. We have to provide tools for them to use to understand that these medications may not be what they want to use and that there's other alternatives. Secondly, we like to advocate. We advocate for change. In our long-term care facilities, we work very hard to get these numbers down, and I love seeing our facility rise in the ranks of being the best at successfully reducing antipsychotics and hypnotics. So in conclusion, we really want our substance use disorder individuals to get the care that they need. And I really think that if we all spoke up and we all had a voice, we could get these substance use facilities in all 50 states.